language of anatomy. Okay, planes, body planes. If we draw a midline section through the body and divide into two halves, we call this mid-sagittal section, which is what this results in, mid-sagittal cut. We can also have, again, this will be also another example of mid-sagittal cut. We can have parasagittal section, which means right and left, but unequal. They are not mirror images. Okay. We can also have a frontal cut. If we draw a plane across here, as obvious in this module, this would be a frontal section. I have an anterior and a posterior segment. That's a frontal section. What you're looking at here as well is mid-sagittal aspect of a real human brain. Whereas on this cut here, a cross-section through the spinal cord, also called C-section, okay, divides. We are going to review the language of anatomy and the systems. This is the muscular system. Primarily consists of muscles, voluntary and involuntary, ligaments, as well as tendons. Muscular system, joints, tendons, ligaments. The endocrine system consists of the major organs from pituitary all the way to the testes in the male and the ovary in the female. But this system is a slow action system compared with the nervous system. Nervous system is fast action, speedy, if you will, quick response, whereas endocrine system will be a slower system. All endocrine organs produce their hormones directly into the blood. That's what makes that endocrine different from exocrine. Again, this will include the pituitary at the base of the brain, okay, thyroid in the neck, with the parathyroid glands behind the thyroid, and closing your voice box, which is your larynx. There's another organ here that is not shown. That will be the thymus. It sits in the mediastinal cavity. Then if you go to the abdominal cavity, you see your suprarenal glands above the kidneys. Then here's the adrenal gland, more like a diamond-shaped structure. Also produces hormones. The middle part produces epinephrine, often called your adrenaline. Here's the pancreas, produces insulin and glucagon, again directly in the blood. In addition to the pancreas being a digestive organ. Again, the testes in the male, testosterone. In the female, the ovary, estrogen, progesterone. Now, if we compare that system with this system will be the nervous system, which consists of a speeding process, brain, spinal cord, and all the associated nerves and receptors with it. Receptors from the skin, receptors from different organs. That's the nervous system. Quick, fast. Short acting, endocrine, long acting. The integumentary system, the integument consists of skin, nails, hair, and the associated glands. Integumentary. Protection. Okay? Circulatory system. Circulatory system, of course, consists of cardiovascular, the heart, associated blood vessels with it, veins and arteries. Veins bring blood back to the heart, arteries take blood away. And again, we can include the lymphatic system as part of the cardiovascular system. We can include the lymphatic system, not shown here, also as part of immunity. Now, let's talk about the major organs in the body. The body cavities consist of the cranial cavity, okay, and the vertebral cavity, which houses the spinal cord. Of course, it houses the brain. These two combined will be called the vertebral cavity. Will be called the dorsal cavity. Vertebral, cranial will be called the dorsal cavity. Everything else anteriorly, okay, including the thorax, the abdominal cavity, and the pelvic cavity, all those will be the ventral or anterior cavity. Now let's spend some time talking about these cavities. The thoracic cavity is partitioned, okay, from the abdominal cavity by the diaphragm. The diaphragm is dome-shaped at this position. The thoracic cavity is further divided into right pleura, left pleura, with the mediastinal cavity in between them, which houses the heart on the inferior edge. As a result, we call that the pericardial cavity, and the mediastinal cavity will be the superior edge of that. Okay, now let's just move up here. Okay, again, here is the pleural cavity housing the right lung. Here will be, we can take this guy down, left pleura housing the left lung. All of this area will be the mediastinal cavity, but because the heart is so important, it has its own cavity. We call that pericardial cavity, and this superior edge here will be my superior mediastinal cavity, which will be this area here. Okay? Now, stop. Now, the abdominal pelvic cavity is partitioned into 4 quadrants. Basically, from the xiphoid process all the way to the pubic symphysis, a imaginary line is drawn. And from the superior iliac crest on either side, another line is drawn, therefore giving me 4 quadrants: right upper, left upper quadrant, right lower quadrant, left lower quadrant. One more time: right upper quadrant, left upper, right lower, left lower. Our job will be to place these organs into respective quadrants, the organs we identified a few minutes ago. Then the abdominal pelvic cavity can also be partitioned into 9 regions, to be more specific. These lines are drawn specifically from the mid-clavicular line on the left, mid-clavicular line on the right, imaginarily, and again we'll retain the iliac crest lines drawn. Then we drew another line right below at the intercostal level, okay, inferior edge of your costal ribs. Therefore, that gives me 9 regions: 1, 2, 3, 4, 5, 6, 7, 8, 9. Now, I have right hypochondrial region. I'll show you here it is right here. Right hypochondriac region, mid epigastric region, left hypochondriac, hypo below the costal ribs. Then I have right inguinal, left inguinal, pubic region. Okay. Then I have the right lumbar, left lumbar, and the umbilicus region. Now, major organs In the thorax, okay, we have the ventral cavity, which consists of the thoracic cavity, abdominal cavity. Our responsibility to be able to identify these organs. Right lung, left lung, both are in the pleural cavities, and the space between them will be the mediastinal cavity. Mediastinal cavity. Inferior edge of that mediastinal cavity will be your pericardial cavity, which houses the heart. Superior mediastinal cavity is in this region where the great vessels leave and come back to the heart. Here's the position of the diaphragm, the liver, the stomach, colon, transverse colon, and of course, here's all your small intestine. Here's your colon again. Actually, this is the first part called the cecum. Ascending colon, and that corner will be the hepatic flexure, also called right colon flexure, transverse colon. This corner here will be the splenic flexure or left colon flexure. Descending colon then becomes the sigmoid colon before it empties into the rectum. Again, small intestine, two parts to it, the duodenum, the jejunum, and the ileum.